Hello everyone, my name is Milena and I'm going to be talking to you guys about arrhythmia, which is also known as dysrhythmia. So what is an arrhythmia? An arrhythmia has many underlying meanings concerning the heart. An arrhythmia can be defined as an abnormality of the rhythm of the heartbeat. Arrhythmia concerns the change in the sequence of electrical impulses of the heart. Electrical impulses occur too quickly, too slowly, or erratically. This is what causes the heart to beat in irregular ways. The heartbeat does not function properly. Due to this, blood is not pumped efficiently. Organs such as the lungs, brain, etc. do not function normally. This can cause such organs to become damaged or even shut down. When this occurs, an arrhythmia can be classified as serious or life-threatening. One must also understand how the electrical system of the heart works in order to associate irregular heartbeats with arrhythmia. An electrical impulse begins at the sinoatrial node, which is also called the SA node or the sinus node. Beginning in the right atrium, as shown in the picture, it travels through the atria to the atrioventricular node, which is also called the AV node. From here, the electrical impulses travel down to the Purkinje fibers, and from there they spread to all the ventricles. The heart will pump from about 60 to 100 times in a minute if the electrical impulse is transmitted normally. There are many different types of arrhythmia. Tachycardias consist of a heartbeat of more than 100 beats per minute. Bradycardias consist of a heartbeat of less than 60 beats per minute. Some originate in the atria itself. Sinus tachycardia occurs when the sinus node sends out electrical impulses at a faster rate than usual, speeding up the heartbeat. Premature atrial contractions, also known as PAC, are when an early beat occurs in the atria. This causes the heart to beat before the next regular beat. Atrial fibrillation occurs when the atria fire electrical signals in a completely uncontrolled manner. Atrial flutter occurs when the atrial muscles contract quickly due to rapidly fired signals. This causes a quick, steady heartbeat. On the other hand, some arrhythmias originate in the ventricles. For example, ventricular tachycardia occurs when the electrical signals cause the heart to beat faster. Symptoms of arrhythmia may include dizziness and the inability to keep one's balance. In addition, one may experience palpitations, which can feel as if one's heart is literally beating out of their chest. Angina can occur and cause one to have chest pains. If you suffer from an arrhythmia, you may feel weak at times and even faint and lose consciousness. Dyspnea, or the shortness of breath, is also a common symptom of an arrhythmia because of the insufficient blood supply being passed to the lungs. The most common ways to detect an arrhythmia are EKG tests and a Holter monitor. A Holter monitor can record the electrical impulses of the heart for 1 to 2 days. Regular daily activities can be done while wearing a Holter monitor. An electrocardiograph is a test that detects and records the electrical activity of the heart. It shows the pace of the heartbeat along with the heart's rhythm. Unfortunately, it does not record irregularities that do not occur during the test. In place of this, a Holter monitor is prescribed for a few days to catch the abnormal heart rhythm. Drug-induced treatments are commonly used to treat arrhythmias. Medication can be used to slow down the heart rate. Beta blockers such as metoprolol and atenolol are common medications that slow down the heart rate. Atrial fibrillation can be controlled by calcium channel blockers such as verapamil and diltiazem. Medications can also be used to restore a normal heart rhythm. Blood thinning medications can treat arrhythmias. Surgical options and procedures can be used to treat serious arrhythmias, and a pacemaker is a small device that is placed under the skin of your chest or the abdomen to help control abnormal heart rhythms.